Welcome to CareSmarts 360 on Air, a home care podcast. I'm Erin Cal, Senior Sales Consultant at CareSmarts 360. Today, we're diving deep into all of the details of home care. We're talking heart, soul, and a whole lot of human connection. And who better to guide us through the heartwarming journey than the one, the only Ruben Hernandez Rodriguez, the Vice President of Senior Care and Clinical Service as Partners Community Health. In his role, Ruben provides strategic leadership for Wellbrook Place LTC homes, ensuring the delivery of high quality and safe care. Ruben's extensive experience encompasses strategic leadership, the implementation of safe care practices, and a strong commitment to patient-centered care. His background showcases a successful track record in areas such as patient care, strategic planning, quality improvement, and financial management. He is also a proponent of lean principles, servant leadership, and the value of evidence-based practice. Today, Ruben will be sharing his insights on why a human-centered approach is essential in home care, emphasizing the importance of building strong connections with clients. Welcome to the podcast, Ruben.
Thank you so much for having me. I'm so excited to be here today.
Oh, I'm glad. So we'll jump right into it. How does prioritizing human touch and a comrade relationship concretely improve home care outcomes for both clients and providers?
And I'm going to start the conversation speaking from as a nurse because that's my background. And human touch, I think sometimes we forget the incredible impact that can have in the client's journey and in the healing process. And that's one of the first principles that we learn in nursing in school, creating that therapeutic relationship and that human touch and the benefit that that can provide to the clients. So speaking from my nursing experience in the emergency department, where I practiced for 10 years at St. Joseph in Toronto, it's a crazy and chaotic space, but yet that meaningful relationship with the patient enable us to understand really where are they coming from, what are their needs, and then adding that emotional perspective can ensure that this one visit can support all the needs and prevent multiple readmissions to the hospital and multiple visits to the emergency department. And I think the same applies in the home care environment. If we develop meaningful relationship and meaningful connections with the individuals, then we are in a better position to enhance communication, reduce the anxiety and the stress, not only of the client, but also the caregiver. Oftentimes in the equation, we put a lot of human touch on the patient itself, and we forget about the emotional struggle that the caregiver might be experiencing during this journey. So the human touch cannot be exclusive to the client itself, but also expanded to the caregiver, because oftentimes the pressure in the health system doesn't come from the client itself, but from the experience of the caregiver. So that human touch will increase that sense of trust from the caregiver perspective and reduce that anxiety, and then improve that emotional support. And I'm going to give you a good example. And a few weeks back, I have the privilege to visit New Brunswick and see some of the amazing work that they're doing in the province in the project Nursing Home Without Walls. And when I went there, what really impressed me the most was that grassroots in the community, engaging with the people where they are. They go to libraries, churches, community centers, the mall, and then the goal is to meet people where they are and establish that meaningful connection from a human touch perspective, and then bring people in through that social connection, and then being able to support them in the navigation and the connection with the health system. So I think without developing those meaningful and trusting relationship in any space of the health system, but specifically in the home care environment, is what will enable us to support people for aging, healthy aging, aging in place, and aging in community.
Absolutely. And how can home care organizations practically prioritize deeper human connections amid efficiency and cost concerns?
Um, I think the first approach, and I see a lot of significant work happening across Canada and here in our province in Ontario and in Toronto. And it's about person-centered care. Sometimes comes as a buzzword or as a cliche, but truly person-centered care is when, I'm going to go back to the roots of nursing as well. Madeleine Leringer, one of the first nursing theorists, developed the Sunrise clinical care, and it's like based on cultural care. And cultural care and person-centered care, I think, have a lot of synergies because at the end of the day, we want to put the person at the center. But oftentimes we confuse putting the person at the center by putting wraparound service around there, and then all the service come to the person. But person center goes beyond wrapping around the service around the individual. Person center means the person voice is at the center of what is being offered to them. That's why at Partner Communities Health, we are very proud of using co-designing approach when we developing programs for the community and to enable home care to flourish, because we listen to their voice. We take their perspective and use that to improve our communication, to improve the services that we provided, because it's easy for us to partner with other care providers and together put a suite of services together to serve the people. But does that always respond to the need of the individual? Sometimes it doesn't, because person-centered required also to involve the voice of the individual. So we need to be sure that we incorporate the voice of the individual. And I'm going to reemphasize again, it cannot be exclusive the voice of the receiver of the service. The caregiver of that person has to be part of that conversation, because when we start putting their voices together and see what they need, then we might be able to tailor it, the care really to what they need. And a good example of this success from a community perspective that can be embedded into home and community service is the navigation project that Mississauga Ontario Health Team, in partnership with Partner Community Health, Trio Health Partners, and 24 other organizations in Mississauga have come together to create this platform where people can self-navigate the system and get connected with the service that they need. But more importantly, we can also bring them on site and wrap around service around there. But the basics of this was listening to the individual, see where their barriers were within the healthcare system in Mississauga specifically. And sometimes what we really need to create this person center is to understand who these persons are. And evidence-based practice is a good avenue to do this. The Institute of Better Health, our Trillium Health Partners, have done a magnificent amount of work to characterize what these personas look like. And Dr. Kerry Kurowski and Dr. Walter have done this amazing work in Mississauga to identify what these personas look like. So now that we know what they look like, if we also integrated the voice, we will be in a better position to truly create that person-centered approach that wrap around the service, but those wraparound service come from the voice of the client and the caregiver.
Right. And how do servant leadership and team building principles influence home care teams to build comrade relationships with clients?
That's a great question, Erin, and you're preaching to the choir with this question, because I'm a big proponent of servant leadership and transformational leadership. And servant leadership is something that I practice myself. And when I was working on my doctorate studies on my PhD, it's something that I explore a lot, because servant leadership comes from this perspective that as you grow in accountability or in rank on your leadership, it's not that you became more powerful, but you became a bigger servant. And then the tools that you can provide your team from that perspective would truly enable this camaraderie work in home care or in the health system. And I'm going to sort of try to colorfully explain this for you on how I see this. I oftentimes, when I speak with my team, there is this traditional perspective that if I am the vice president, everybody's working for me. And I try to change that structure of thinking within my team in telling that, no, I work for you. I'm here to put the tools, process, strategic directions that would enable you to execute your functions to the highest of your capacity. And then a servant leader is not only paying attention what the team needs and what the community needs and what the clients and the caregiver needs, but also not only in terms of resources, but also in development, giving them the tools in competence in development. At Partner Community Health, we have developed our Institute of Leadership Development, where we quarterly meet with our teams and provide them with the knowledge required to be able to do their functions within the long-term care space and within the community space. And this is because we as a servant leaders identify that our role is to serve our team and create capacity within our team so that they can provide the best service possible to our clients and to our residents into the long-term care. And sometimes when you change that hierarchical perspective, then you can enhance the hands-on of the team, because then they see you as a collaborator within the team and not someone that is um, um, overseeing their work. So I don't believe in macromanagement. I believe in giving people the opportunity to think, to use evidence-based practice to enhance the care and work collaborative. You often will hear me saying, our health system have been built for competition, not for collaboration. And that's exactly what servant leadership does, is move away from the competition and move towards the collaboration, because at the end of the day, every single health organization in this province and in this country have only one goal, and the goal is to provide the best service to our community. And if we're going to do that from a competition perspective, the system will be not learning as a whole. So we need servants leader, because servants leader will create that collaboration, but it will also create the opportunity for system learning. So if we collaborate, we can then share those knowledge and those discoveries that we encountered in our functions to improve the system as a whole. For example, paper performance is a great example of how we are built for competition or not for collaboration. An emergency department will get more funding if their scorings highlight them that they have a great performance. So you will see leaders in the emergency department developing new tools and new processes to improve the performance so that they can then that funding. But that doesn't stimulate them to give that knowledge to another provider to learn from what they use to improve their system. What if we start paying per innovation and not per performance? What if we funding people that create collaboration opportunity to learn from each other so the system as a whole can learn? Servants leaders have a greater opportunity to create this a space of collaboration, because their goal is not to become more powerful, but to be able to serve more people. And that's what I see the opportunity to create that connectivity and that synergy of intent. We are all doing this work because we are passionate about it. We are passionate to create the best health system possible. And sometimes now I say, I'm 48 years old now. 20 years from now is when we're going to have that big pressure or seniors. I am going to be one of those individuals. If we don't use our servants' perspective to create a better system today, we are not going to be benefiting ourselves 20 years from today, when we will be part of that large population of seniors that will be putting pressure into the system.
Right. And how can we ensure technology doesn't overshadow the crucial human touch in home care?
I think I used the first concept of that on earlier response, but I think we need to use more co-design and the voice of the clients and the caregivers and the healthcare providers on the development of the technology. I'm, I'm a big proponent of technology. I have worked in organizations where technology was at the front run of moving the organization. Technology can enable us to do better data collection and use data-driven decision making to provide the best services to our communities. But if we only use what we think will be best for the community and develop technology on our personal perspective, we might not be developing the best tools possible to truly support the needs of the community. But when you use person-centered approach, you put the person at the center and you use their voice to design the future of the health system, and you use that voice to then complement the development of technology and use technology to enhance their service provision to the community, then we will be in a better position to serve the system. Last week I had the privilege to participate at the Created Disrupted Lab at U of T, and they put people together, the innovators, and they use mentors to support people. And I love the perspective of having mentors and helping entrepreneurship to create better technology tools that can help healthcare providers. And the one thing that it will be amazing is if at that same table can be the end users and the caregivers looking at this technology when they are almost ready for deployment to say, well, it will be better for me if I, as a caregiver, also have visibility of the data so that I can complement it with my perspective of what I see every day in the home. Imagine home and community service providers, we relied a lot on what the family has to say about the needs of the individuals, but imagine if they also have a voice on that technologies that we are developing to support people. I mentioned earlier about the navigation system that we have created Partners Community Health in collaboration with the Mississauga, Ontario Health Team, Trillium Health Partners, and another 24 organizations. I think part of the success of the navigation system is that the voice of the individuals that will be the recipient of the care was incorporated into the development of this technology. And I think the same can apply. And I was at the Point Click Care Summit in Vegas a few weeks back, and I encountered a young entrepreneur individual from Brampton, Ontario, nevertheless, and I met him in Las Vegas. And he's 25 years old, and he's very passionate about developing tools or technologies that can support caregivers or healthcare providers on improving the quality of care in the senior space. And what really impressed me about Ian is his name, was that he actually moved into a retirement home for a year to see firsthand the experience of the caregivers, the
Wow.
experience of the residents, the experience of the care provider, and then develop his technology from that experience firsthand. That is the future of technology embedded into long-term care, into home care, into any part of the health system. You need to go observe and ensure that as you develop your tool, you are already mitigating the risk factor of being disruptive in the space. He went there and saw what the problem was and built the technology based of the experience that he saw firsthand. If more entrepreneurial organizations and technology developers use that approach and go hands-on to see what the experience is, I think technology will not be a disruptor, will be our best friend.
Mhm. Yeah, that's amazing. And last question for you, Ruben. What are the biggest misconceptions or challenges about human connection in care that you see?
I think some of the big misconception about human connection is that people sometimes think that you have to be best friend with someone or that you need to know them deeply to really make this connection. But I think a lot of people use Angelo's phrase that people will not remember what you did with them, but they will remember how you care for them. And I don't remember the phrase deeply right now, but in hence what she was trying to do, when people see your effort, when people see that you want to meet them of where they are, is when truly the opportunity to create that connection exists. Because I think we have spent a lot of time trying to figure out how to provide the best care possible. And the challenge that we spend so much time in that is because we don't incorporate all the time the voice of the recipient of that care. And that is the misconception that we continue to use that paternalistic approach that we are the expert and we know what you need. But in reality, human connection is about not only that physical touch, but that emotional connection of empathizing and with compassion, understand where they're coming from. We have one of the most multicultural nations in the world. We need to understand that cultural experience that people come with and then use our empathy and our compassion, which are values of planet community health, to really understand. And home care providers can come with those lenses of empathy and compassion to really understand the need of the client. That is not only the physical need of cure my wound, but my wound is one aspect of my need. What is the emotional distress that this wound have created on me? And if we don't create these emotional connections, we will not be able to increase this. And I'm going to go back to nursing home without walls in New Brunswick. I think the success of that program is that they didn't invite people to come to the healthcare center or to the long-term care home. They went to where the people were. They made that first approach to create that human connection. And the misconception is right there. The misconception is that we need to make the connection when the people come to the health system. No, the emotional and the human connection has to be made before so that that trusting relationship can exist. I spoke with one of the individuals in there. His name is Patrick. And the success of his center, people are now inviting them into their own houses. Like, how many people? I mean, I live in a condominium, and previous to this home where I lived before, I lived in a condominium for 8 years. There was 200 suites. I only had 3 friends in 200 units, people that I pass in front of their house on the elevator every day. And then we have become so individualized into our own space that we forgot that humans started the community living as a tribe, where the tribe worked together for the good of the tribe. Hence why servant leadership is so important. We are here for the good of the tribe, and we need to meet the tribe where they are, and then work together with the people in the foundational needs that they can express. And you can only hear what they need if you approach people with empathy and compassion, and you foster that meaningful and trusting relationship even before they have health needs, because you can meet them at that emotional level and create that trusting relationship that then they will naturally come to you when they have needs. At Partner Community Health, we developed in this integrated senior hub, and our first approach was to develop or spend the day with us. Not a string attached. You come when you want, for when you want, and for as long as you want it. And then through that interaction, we've been able to develop a strong relationship, listen to what they need, and then use that to co-design the future of our programs. Or we need more social integration, social activity. We need more um, uh, physical well-being, physical exercise. So now you create that social connection between individuals. They motivate each other. They come to the exercise together. And now, what if we use that same principle into home care? That home care is not just the experience of going and delivering a specific care, but creating that trusting relationship. And I think I want to finish this question with a personal experience. My mother was diagnosed with terminal pancreatic liver cancer in June 2023. And we went to the hospital, to the emergency department. We got the diagnosis. Mom was in the hospital for 3 days to have a full understanding of where her cancer was coming from. When you are at a metastatic stage, you want to understand where it came from. Maybe not for the benefit of my mom, but the benefit of my sister and I, to know what lifestyle changes we might want to take if this is something that hereditary might occur again, and that sort of thing. And the first thing that my mother said was, I do not want to come back to the hospital for anything else. Whatever it needs to happen here has to happen now, because I don't want to come back. So as a son, I listened to my mom need, but I was also listening to my mom as a healthcare leader with a servant hand on it. And I was like, okay, if all what she wants is to be at home, what are the steps that I need to take to be able to fulfill this wish? So we set the goal of cares with mom. I meet her at her cultural belief of what did she needed. I want to enjoy my experience at home. I don't want a space of sadness, of pity. I want us to be able to celebrate life. Okay. Now I know the second emotional connection that she needed. She wanted to be sure that we continue to celebrate whatever time we have left, to be able to have a meaningful time together. And then staying at home is not something that I by myself could contribute. So we connect with the amazing work of the Dorothy Lade and the home services. And then before I left the hospital, I was already connected with the case manager. And the first thing that she asked me was, what do you need? Not what my mom needs. What do you need? She made that emotional connection with me. What do you need to be powered up to ensure that you can meet these wishes from your mom? And I say, oh, what I need is the days that I need to go into the office to be able to have a PSW, so that I know that the days that I cannot be at home, there is someone there with her. And it will be limited. I had the benefit to be in a hybrid position that I was working almost 30%, 70 at the office and 30% at home. And then those 3 or 4 days that I was going into the office, I built that trusting relationship with that case manager. And then I built that same trusting relationship with the PSW that was coming on those days that I was going into the office, to the point that she will text me at lunchtime. She ate her entire meal. Even when I was at the office, I have that reassurance. But I think palliative care team have sort of figured it out the wheel and figured it out that that emotional connection with people, that is no physical touch, is emotional connection, understanding people of what they need. When we left the hospital, the doctor said that my mom have maybe 2 weeks to live. We have 122 days. We have an
Wow.
amazing summer that we enjoy. And this was possible because someone understood that we needed to make that emotional connection to be able to fulfill her wishes. And at the end, it was not costly for the system either, because most of the care was driven by me, and only in those small instances where I needed someone to oversee her at home to ensure that she was safe was the only cost to the system. Because when I felt empowered and when I trust that what was put in place will truly support me, then I was able to relax and I was not on this constant anxiety. We need that. We need to give that power to people, and home care is the space to create that same approach that palliative care have developed, to give people the tools to stay at home, and that comes from a trusted and empowering relationship that servant leaders can bring into the system, where collaboration is at the front and technology is an enhancing of the system and an enabler and not a disrupted. And that requires that technology is developed in co-designing with the healthcare providers and the end users. And that's how we're going to be the future of the health system in Canada and in Ontario.
Absolutely. Well, thank you so much, Ruben, for sharing your expertise. We really appreciate it. And to our lovely audience, thank you for tuning in. Until next time, I'm Erin Cal signing off.